We touched on the numbers and the warnings, and we turn now to the reality in our hospitals and the fear this COVID surge will get worse before it gets better. Staffing shortages and an uptick in patients, the looming issues here. ABC 15's Mike Pelton joining us live. And Mike, common theme you heard today, it could be a very rough few weeks ahead.
Yeah, well, Steve, Wednesdays have become a day where we hear from several top doctors and data experts. And today it's very clear there's a difference between having an available hospital bed and an available staffed hospital bed. Case in point, here at Valleywise Health, we're told as of this morning they were down to just one available staffed ICU beds, but they had 10 unstaffed ones. Finding extra staff and expanding capacity for a potential bigger spike in patients, a priority across the state, including at Valleywise Health.
Making sure that we have our plans in place to, if we need to, again, allocate additional beds in areas that we don't currently have patients today, we're ready to do that. We have those beds on hand.
So how bad will this surge get? ASU Biodesign Institute Executive Director Dr. Joshua LaBaer says if no changes in how we slow the spread,
it will probably hit some kind of a peak at the end of January, somewhere early February. At that point, we may have as many as 200,000 cases in the state of Arizona. So the numbers will be pretty huge.
Banner Health Chief Clinical Officer Dr. Marjorie Bessel.
We expect to get significantly strained in the healthcare system, which will mean more difficulty taking care of these very ill COVID patients, as well as more difficulty caring for other individuals who have heart attacks, strokes, infections, and the like.
Dr. Bessel projects Banner will hit 100% licensed bed capacity this upcoming Tuesday.
At this time, we are participating with the Arizona Surge Line, which is helping to load balance the entire state. At this time, we are able to accommodate ICU patients in the Phoenix area that require that level of service.
But a grim outlook ahead. I asked about the possibility we could see Banner go to crisis standards of care, a sensitive subject in the healthcare industry. Essentially, it's lesser quality care that could lead to doctors making tough choices.
It is very likely, very, very probable that we will go into some aspects of crisis standards of care. I want to remind everybody that crisis standards of care can mean some of the following. Things like increasing nursing ratios, increasing the number of individuals that a physician has to see.
Now, the state coronavirus dashboard currently lists more than 170 ICU beds as available statewide. Asked if those beds actually have staff late this afternoon, the Department of Health Services tells me hospitals are instructed to only report staffed beds, although we're not told where all of those beds are located. And we have heard from some doctors around the state who say right now ICU beds are hard to come by. For now, we're live in Phoenix this evening. Mike Pelton, ABC 15, Arizona.